It's all too common a scenario these days. Millions of Americans are needing to weigh the decision to pay their rent or buy food rather than get their much-needed prescriptions filled. Prescription assistance programs have been part of the healthcare system for many years, providing millions of qualifying patients with prescription medication for low or no cost. While these programs are an important safety net, they can be constantly changing, time-consuming, overwhelming, and confusing. But fortunately, joining us today to offer a helping hand is Maya Loveland from the Simple Fill Prescription Assistance Program. Welcome, Maya.
Thank you for having me.
We need you here. There's a lot of information out there. Let's start with the very basics. Help us understand what is the Prescription Assistance Program, otherwise known as PAP, and who is eligible.
Prescription assistance programs are programs that are offered by pharmaceutical companies to provide free or low-cost prescription drugs to qualifying individuals. Each pharmaceutical company is a little bit different, but generally they're designed to help patients who have limited to no prescription coverage and have displayed a financial hardship. These programs started out helping a lot more patients who had no insurance at all, but these days we're seeing a lot more patients coming to us who actually do have insurance, but they now have a very unaffordable copay, or their medication is not covered in their plan anymore. Oftentimes we also see a lot of Medicare patients coming to us who have hit their coverage gap.
So how exactly does the Prescription Assistance Program work?
Each pharmaceutical company is a little bit different. Each one has a different application and a different eligibility guidelines. But all of them do require that the patient and the medical provider submit a portion of the application. The patient is also responsible for including documentation that shows that they're eligible for assistance. And this documentation includes tax returns, copay receipts, insurance cards. It's all a little bit different depending on the patient's situation, the patient's medication, and the pharmaceutical company that they're working with. Once all of that information is gathered and submitted to the pharmaceutical company, their application is then reviewed, and if approved, then they're enrolled into the program for up to 1 year before they have to go and re-enroll once again.
So if you are a patient who needs multiple medications, you are doing this process for each pharmaceutical company that you're dealing with, and then you're doing it again every year?
Yes. And you're doing your refills a little bit differently throughout the year as well. And sometimes you can get enrolled into a program and your end enrollment date is one date and then your other one is this. So there's a lot of moving pieces that you have to be paying attention to make sure that your treatment continues.
Which is even more pressure if you are suffering from an illness of some sort, or if you're older and just not able to manage this sort of stuff.
Absolutely. It is a lot to handle, and it can be completely overwhelming for a lot of patients.
So how does someone find out if there's a program out there for them?
The easiest thing to do is call Simple Fill. We keep up to date on all programs that are out there and what their eligibility guidelines are. Another option is if the patient knows who makes their medication, they can do a quick search online. The pharmaceutical companies have information about their patient assistance programs right on their website as well.
What if I'm a patient and I decide to hand over the whole process to Simple Fill?
At Simple Fill, we want to simplify the entire process for the patient and take the burden off the patient. What we do is we always start where the patient can just pick up the phone, give us a call, and talk to what we call a pre-qualifier, who will learn a little bit about the patient's situation, learn about their medications, and tell them right over the phone if they believe they're going to be eligible for assistance. The only thing the patient needs to do is sign the application that we sent out and submit this documentation that we need for them to show that they're eligible. We take care of the entire process from there. Once the patient is enrolled into the program, they're assigned their own advocate. Then we manage the entire refill and re-enrollment when their enrollment expires. We handle all of that.
So Maya, how can someone find out more information about Simple Fill and whether they're eligible?
They can go online to our website, or they can just give us a call, and we can learn a little bit about their situation right over the phone, see if they're eligible, and if so, we'll just start working for them immediately.
Thank you so much, Maya, for being here. Such great information. If you or someone you know is struggling with unaffordable medication, you can visit simplefill.com. And of course, you can find everything we discussed today on our website at accesshealth.tv.